Today, we're talking about men's sexual health. And to talk about that today is Dr. Stieglitz. She's a urologist at Baptist MD Anderson Cancer Center. Thank you for joining us.
Thank you for having me.
There's something new that you're offering patients in Northeast Florida. What is that?
Sure. So I am new. I've been at Baptist MD Anderson for a couple of months now. And not only do I offer care for patients with cancer, but I'm also helping patients who either don't have a cancer diagnosis or who are ready to move on with their life and get back to normal. And one of the things that we're highlighting today in that arena is the men's sexual health program.
There's 13,000 urologists in the US, but only 1,000 do implants. Can you explain, first of all, what that is and that you actually perform these, right?
I do, yes. So like she said, there are 13,000 urologists in the US and only about 1,000 do implants or prosthetic devices. And the number who do them on a high volume is even smaller than that. And a prosthetic device is a device that goes into the body on a permanent basis. And so in my arena, that would be a penile prosthetic device, an inflatable penile prosthesis, which helps men achieve erections when other things don't work anymore. And there is an algorithm. There are many other options. We don't just jump to surgery unless that's what the patient wants.
Do you have an implant that you can show us?
I do. All right. So it's not as much fun on Zoom, but this is an example of an IPP. That is the abbreviation for it. So for whatever reason, if the muscles, the blood supply, the nerves in the penis just aren't working anymore, we go in and we replace the main muscles in the penis. And that's why there are two cylinders. And these will go in, and this pump will go into the scrotum. And it will be near the skin. So it's almost like having a third testicle, but no one will know it's there unless you tell them it's there. And when you're ready for an erection, all you do is squeeze the pump a few times. I don't have it set up. And fluid goes from what would be a reservoir, the size of about a small plum, that goes in the abdomen. You don't see it or feel it. And fluid goes from the reservoir into the cylinders, and you get an erection. And when you're all done, there's a release button. And this is really life-saving for patients, or life-changing, not life-saving. It restores marriages. It restores intimacy for patients who haven't been able to have sex because of cancer treatments, because of trauma, because of medications, diabetes, heart disease, whatever it is. This surgery is incredible. It's one night stay in the hospital. That's for antibiotics overnight. And patients are so happy.
What are some lifestyle changes they may expect with this?
So with prostate cancer, I made you some cards. 25 to 75% of men after being treated will have some degree of sexual dysfunction. And most of the time, because of the way that you're treated for it, the pills aren't going to work anymore. So the names you're familiar with, Viagra, Cialis, they're just not going to work because the blood supply has been compromised. And that's what those pills rely on. And so I have a lot of patients who'll come see me for the alternatives, and sometimes it'll work, but most of the time they're going to need this surgery. And then the other side of that is urinary incontinence. And many women are used to it, leak of urine when you cough and sneeze and bend, especially after having children. But men are not used to this. And when their prostate is treated and they leak urine and have to wear pads or some sort of diaper, this is very disturbing for them. Most of them recover within a year, but 9 to 16% of them are still wet after a year. And so that's the other type of procedure that I do, that I offer men after prostate cancer treatment. It's a urinary sphincter. And that is very similar. It's a prosthetic. I don't have the model of that with me, but it's like a tiny water balloon that goes around your urethra. And you get another pump, but it's a lot smaller. This one goes in the scrotum, and when you need to pee, you push the pump, and it's an automatic cycle. The balloon deflates, the urine comes out into the toilet or wherever you are, and then the balloon reinflates and keeps you dry.
So amazing technology nowadays, and all the things we can do to help people. So what are ways that you help your patients manage these new lifestyle changes?
Well, the first step is getting them in the door. The all of my men who I have put these artificial urinary sphincters were wet for over 10 years.
What?
And they said, I didn't even know this was an option, is what they told me.
Wow.
And so that's also the purpose in doing this segment is
Right.
don't have to live like this if you don't want to.
Amazing. And you work in a cancer center, but you don't only treat cancer patients, right?
Right. So my title is not urologic oncologist. I am a general urologist in that I will treat patients with cancer. I'll treat patients post-cancer, and I'll treat patients without any cancer at all.
All right. Let's say someone wants to get in the door. Where can they find your information?
The general website is baptistmdanderson.com. They can find us on social media, and those are the best ways to find us. And they have phone numbers to call. And for anyone that wants more information, I'm also doing a webinar that patients can attend for free to get a lot more details about men's sexual health and urinary incontinence and specific details about more treatment options. It'll be about an hour long later in September. And that information will be on the website too.
Awesome. Well, thank you so much for your time today. I think this is going to change a lot of lives.
Okay, thank you for having me.
Of course. And if you'd like to see this segment again or get more information, go to firstcoastliving.net.